Okay, we're live.
Welcome everyone. Welcome back to another session with Pre-Dental Universe. My name is Tiffany, one of the pre-dental students monitoring today's session, along with Sherry. We have an exciting presentation day with Dr. Dent. And on that note, feel free to take it whenever you're ready, Dr. Dent.
Perfect. Well, thank y'all for having me tonight. I know this is a little bit unique for me talking to pre-dental students, as most of my lectures usually come to dental students or doctors and hygienists. So um, I'm gonna do my best to kind of share my story. I'm gonna try to keep everything as practical and real as I can, and then at the end, be happy to answer anybody's questions. So, just a brief kind of intro to who I am. I'm a general dentist. Been practicing since 2003. Graduated from LSU. Um, Currently, these are just a few of the things that I do now. And what I want to share with y'all is, when I was asked by Sherry to do this, I wanted to kind of think about what it was like for me way back when I was in your shoes. When I was an undergrad, going, one, how in the hell do I get into dental school? And what do I need to get into dental school? And why am I going to dental school? And so we'll go through kind of that story. I'll share some things, and like I said, at the end of this, hopefully I'll get a little information that's worth y'all being up here late at night on a Friday. Uh, so when I first started, like I said, graduated high school, went into my undergrad at McNeese State here in Lake Charles, Louisiana. That was back in '96, and I actually got into dental school after 3 years of college. So by the paper, I am a college dropout. So congratulations, you have now been been starting this program with an official college dropout that happens to be a doctor. But I did get in to dental school in '99 when I was 20 years old. And starting dental school at 20 in New Orleans was a very interesting time. And so I graduated at 24. And at that point, I still had a lot of people going, so when do you start dental school? And I'm like, well, yeah, I'm already done, so kind of baby faced and young to the world, but, was excited to have kind of a jump start on it. But some of the things, as I was talking about, like what got me there, what made me want to be a dentist, and so when I was in undergrad, I actually became a dental assistant, and so my first 2 years of college, I worked as a chairside dental assistant for a local husband and wife dentist in Lake Charles, and it gave me the opportunity to see aspects of dentistry. It gave me the idea that, hey, look, if I can sit on the other side of the chair and suck spit, get spit on, and do the grunt work, I know I can enjoy the other side of the chair and do the doctor work. So uh, I went ahead, got into dental school, did my 4 years, and when I got out of dental school, I did what most people do, is I went and got a job because student loans were coming due in 6 months, and I had to pay a bill. And so I went and got a job, and that lasted about 9 months. Um, and then I found a private practice, and I opened up a private practice. And then things happened. Ended up moving to Texas and became an associate for a DSO. And then in 2011, opened up another practice as the owner with the support of a DSO. And I've been with them and still with them right now. So that's kind of the timeline, and we'll go through a little bit of each. So LSU Dental School, New Orleans, only dental school in Louisiana, and it accepts right now, it accepts about 65 people a year. So competition is pretty stiff when you got a couple thousand applicants and they're only taking 65. And so I was really kind of okay, I got in, but the questions, that I get, and I got then during my interview process was, how do I know that I want to be a dentist? And so, I told you about I was a dental assistant, and that looks good. You gotta show the intro committee to the dental school that you're committed to this. You got some skin in the game. You want to do it. I actually worked at a dental lab too. I didn't do a whole lot. The guy kind of taught me on the side how to pour models and how to set teeth for dentures. But I was the runner. I was basically just the drop-off kid to go drop off cases to the lab, but from the lab to the offices. But like I said, it got my foot in the door. Um, Here's what I knew when I got out of high school. I knew I wanted to be a doctor. I had one of those teachers in high school that said, "Hey, Jacob, you got pretty steady hands. You should consider something in the medical field, surgeon, dentist." And I was like, "Okay." Um, so when I first got out, I found a job as a runner, as a physical therapy runner. So basically means I would go back and forth to the nursing homes, get people to sign their consents. And I realized quickly I didn't like sick people, which put a damper on being a doctor. So I thought, well, there goes medical doctor. Let me go ahead and try, dentistry. And as I was sharing with Sherry before we got on, all of my family, I'm the first doctor in my family. All of my family's in the oil and gas business. And my dad was kind enough to get me out to one of the plants in Lake Charles in between semesters, and I didn't like not working in the AC, and I figured out that I was much better off with an inside than an outside job. So that kind of helped really ice that for me. But here's my question to y'all, and this is, I told Sherry in the beginning, I'm going to kind of go a little bit off script, probably from what's norm, because I really want y'all to understand what you're looking at. What is the black and white of going into a medical or dental field? And so, you get this stupid question every time someone says, "Well, why do you want to be a dentist?" "Well, I want to help people." That's dumb. Everybody should want to help people. Like I said, you could help people as a waitress at, Sonic. You could help people doing anything. But why would you want to help people working in an environment that smells, is yucky, nobody likes you? This is one of the few careers that before people even introduce themselves, they always say, "I hate the dentist." Think about that on a speed dating kind of things. Like the first time you go out with somebody, the first thing is like, "I hate you." Well, this is going to go real well. So you got to get over that. Part of being a dentist is realizing you're not everybody's favorite. But yes, you want to help people. That should be top of the game for you. But the big thing, money. It's a good salary. Right now, a new dentist coming out of school averages about 120,000 gross a year. That goes up depending on where you live, what your job situation is. You can be your own boss. That's the big plus. If you decide you want to go into private practice, you can always kind of be the top man on the totem pole or top lady on the totem pole. And it's a career that is constantly changing. I've been in dentistry now for going on 19 years. What I thought I knew when I graduated in 03 was nothing to what I know now. And it's a lot of trial and error. And I tell all my young docs coming out of dental school, if you know nothing, you're basically just not a threat to the public. And so that little piece of paper doesn't mean that you have any idea what you're doing. It just means that you have a base and you still need to go learn how to do it in the real world. But here are the cons, and I want everybody to be aware of this. And I Googled some of this stuff. Like I said, I don't really do a whole lot of pre-dental, but I wanted y'all to know this. This is the averages. The student debt right now to go for your 4 years of dental school is $292,000. That is what you will come out of dental school with on average, and you have no job. That doesn't count what you just spent on undergrad, if you spent anything on undergrad. What about the cost of owning a practice? You know, my first practice I bought in Creole, Louisiana, and I'll show you a picture of it. It was a 2-room practice in a town that had one caution light, and it still cost me $250,000. Now, I've got right now 10 dental practices in the state of Louisiana, and each of them cost me about 1.2 million each to open. So if it gives you an idea of, okay, I got debt, I don't have a job, and well, I want to be my own boss because that's why I did this. You know, the days of going to a bank and holding up that nice little diploma and saying, I'm a doctor, don't mean 2 cents anymore. And so these are, like I said, these are just the real things that y'all have to understand. Physically demanding. Your back and your neck are in high stress every day. And you do this for going on 20 years like I am. You know, you see the old dentist that you used to go to and they're halfway crippled up. You know, you will take a class in dental school called ergonomics, and they're going to try to teach you how to sit properly in a chair using your mirror, using proper form, and that's as far as that really goes. Because when you get out in the real world, they know ergonomics. My specialty is special needs dentistry. If I don't roll on the floor at least once in the day, then my day, I feel, is not successful. What about dealing with people? And this is another thing where it's like, I want to help people, but if dentistry was a drive-through, kind of like Starbucks, where you could just deposit your teeth and I'll take them, I'll fix them, I'll give them back, but I don't have to deal with the person on the other end of those teeth, dentistry would be cake. You know, take cheeks and the tongue and all the, nonsense out of there. But you're dealing with people that A, don't like you, B, are probably anxious to be there, and C, sometimes they come in with the most unrealistic expectations of what you can do. You know, it's kind of that saying, like, I'm not a miracle worker. You know, I got to have something to start with. You know, people come in and it looks like they bathe their teeth in coffee every morning, but they want chiclet white, teeth when they leave. It's like some point you just go, look, honey, that ain't gonna fly with us. So we really need to lower the bar of what you're looking for. And it's kind of a downer, but dentists have the highest suicide rate amongst any profession. And you go, wow, why are we not all signing up right now to go to dental school? This sounds amazing, Doc. Well, yes, but it's because that the suicide rate is because it's a very stressful. People don't realize that, but when you're working with anything that deals with the public, that deals with technical details, I mean, you're working in millimeters. Think of it kind of like a brain surgeon on teeth. You are doing things that one slip, it can screw things up, and so the stress level in just what you're doing technically weighs on you, and so when I'm coaching my young docs and I'm talking to students like yourself, it's you got to be great at being a dentist, but you got to learn how to manage it. You got to learn how to manage the stresses that come along with being a business owner, having a staff, dealing with the parts of owning a business that you may or may not have ever had a class on how to teach, someone else to do, or someone that ever taught you how to do it. You need a mentor. You need somebody that can go, hey, look, I've done it. I've been through the trenches. I've been through the fires. Here's how I can help you. And so, pearl for tonight is, if you get into dental school, wonderful. Congratulations. You're one of the top people that can do this. However, even in dental school, find you a mentor. Start early. Find someone that's willing to teach you the things that they learned the hard way. That's not necessarily your instructors. Someone outside of that is always a pearl. And I'll tell you as time goes on tonight who mine are. So this may age me a little bit. I am 42 years old for those that are on the call. So I have a daughter who is in college. So just to kind of give you an idea of my age range here. But when I first got in, like I said, graduated 2003, fired up, thought I knew everything. Everybody had to call me doctor. Like I should have legally changed my first name to doctor because that was the pride I had in that. It was like I made it, I did it, respect it. So I get this associate position in a private practice, large group practice here in Louisiana. And if you don't know who the guy in the picture is, that is Boss Hogg from the original Dukes of Hazzard. And he just resembled very much the entire persona of the owner of the practice that I work for. He was a jackass. I hated him. We almost went to fists a few times. But, here was the things about being an associate dentist was I was the grunt. I got everything that guy didn't want. There was I didn't do I love hearing doctors or dentists especially go, I'm a cosmetic dentist. You never hear a dentist say, I am an ugly tooth dentist. I only want to do the crappiest, ugliest things in the world. Everybody's a cosmetic dentist. If you weren't, then nobody would come to you. So I like that one. That's just not a knock on anybody who ever said they were a cosmetic dentist, but it is what it is. But as an associate, like I said, I had no voice in hiring my own assistants, how to run the practice, what my schedule would be, or really the whole clinical culture or the quality at which the dentistry that was coming out of that office reflected upon me. Because here's the thing to always remember. It don't matter if you own it, if you don't own it. But if your name is on the door, people are going to associate you with everybody in that practice. So just like anything else, if you don't want your name to be drugged down, then don't take the first job that comes along. Do some research and make sure that you're getting into a quality situation. It was good money. Don't get me wrong. I mean, I'm coming out of school. When I was in dental school, I was so poor. Like I could afford croutons, but not the salad. That kind of poor. So I'm making $10,000, $15,000 gross a month. This is huge. And I'm like, okay, the guy's kind of a jackass, but I'm making good money, so I guess I'll stick with it. But I was finding, I'm 7 months into this practice and I was already burnt out. I was tired of it. It's like I just spent the last, 7 years post high school doing everything to get to this point, and I already hated doing what I did. So I left that job. And I said, I am going to go hang a shingle and I'm going to be my own boss. So my first private practice, here it was, the little shack in Creole, Louisiana. So I was 25 years old, but I was $750,000 in debt. So that practice cost me $250,000. I just bought a house. I had a brand new child, and I'm now sitting in a hole where I go, okay, I got to make some money to afford this. My monthly bills were $7,500. I grossed. I cut myself a check for $8,000 because that's the most that I could make out of that office without putting us in the red. So I'm a doctor. I have my own practice, and we're still eating bologna sandwiches. And I'm like, this sucks. This was not in the manual from LSU when it said, please come be a dentist. Everybody's like, you're going to make a butt ton of money. You're going to live high on the hog. You will be working 4-day weeks and playing golf on Fridays and driving fancy cars. And that was crap, at least at this point. And so this was in May of 2004. If everybody remembers 2005, Hurricane Rita, Hurricane Katrina that blew through Louisiana, that really kind of changed the way that I guess my career path changed. But, going back to the private practice, I was my own boss. I made all the decisions. I hired my own staff. I made my schedule. I made my own business plan, which I had no idea what the hell a business plan was because I didn't take that class in dental school because they didn't offer it, because I didn't have any training with it. I didn't have any idea how to hire or fire staff. I hired 2 girls for my Sunday school class at church. And the only thing that's worse than hiring the 2 girls from the Sunday school class at church would have been hiring your family. But I didn't know that. So I couldn't go back to that church after I had to fire both of them. So you see how that's a problem. I had no idea what it meant to be a leader. There's a difference between being the boss or being the chief and actually being a leader. I didn't really know how to lead by example. And I had no safety net, which meant, hey, you know what? If patients didn't show up, if we didn't collect our insurance or we didn't get our loans paid, it was all on me. There wasn't anybody to come back. So like I said, good and bad of private practice, but Hurricane Rita and Katrina came through, and this was the same office that I showed you a year and 4 months after I opened it. This picture actually got me on the cover of the Louisiana Dental Journal as the worst case of Louisiana for the hurricane. So I actually never made the journal for academic achievement, but that's what I got for. So congratulations. But it was a total loss. It left me with a slab, and basically I spent the next 2 years trying to fight insurance to help pay it off, but they kind of got screwed on that. And I spent the next 5 years working in Texas as an associate to pay off an office that I no longer had. And so that was my 2006 to 2011. And then here comes 2011. And I know there's a lot of information out there about DSOs, private practice, associateships. But I work with a company called Pacific Dental Services, and basically, and there's a lot of I've worked for other ones. And everybody, I don't badmouth anybody, but I'll tell you my excuse me, I'll tell you my experience with Pacific is it's almost like I hire them, and I pay them to do the things that I don't want to do that have absolutely nothing to do with dentistry. So I own the practice. I put skin in the game. I purchase the practice. I'm responsible to hire and fire, and I have the authority to do that at my own discretion. Clinical autonomy. Nobody tells me I got to cut so many crowns a day or pull so many teeth or make so much money. Mentoring. They partner with over 700 offices in the country. And so there are people that were obviously much further in their career than I was at the time. And so, great. I had people that I called up, kind of like I'm doing with y'all, saying, hey, tell me what the secret to life is here. Tell me what I'm going to do that's not going to make me trial by fire and be a poor man for the next 15 years. But they taught me the business aspect of it, and the CE. All of that real world dentistry that you don't get in school, I learned outside of it. But I didn't have to worry about insurance, filing taxes, HR, marketing. Here's the thing. Everybody on this call right now, just think, if y'all all got into dental school and you all went and hung a shingle and became your own boss, y'all are all going to compete against each other for the same patient pool. Y'all all want the cash patients or the private insurance patients. Nobody wants Medicaid. Nobody wants government programs that don't pay anything. You want to get paid to run your business. but you're all fighting for the same, fish in the pond. So when that happens and you don't know how to market yourself, you don't really have an identity, you don't have any track record, these are some things that you should start thinking about because, like I said, if you're out on your own, the buck stops there and you're responsible for everything. So right now in Louisiana, like I said, I own 10 practices. All of them are in retail centers. The one to the left is in Lake Charles. Obviously, you see my neighbor is Starbucks. The one here in Lafayette is next to Whole Foods. So we do a really good job of finding high traffic areas. And our practices are a little bit unique depending on the size of them and what type of dentists are in there. So, and I'll talk a little bit about that in a minute. In 2004, my son was born. And in 2006, when we were in Houston, he was diagnosed with autism and totally rocked my world. And I will say this, as a doctor coming out of dental school, I had absolutely zero training or zero desire to be a special needs dentist. I was like, I am a crown and bridge kind of guy. That's what I want to do. And because in dental school, they teach you, or they did teach you, if the child or adult with special needs, that is not your patient. That goes to pedo, that goes to the hospital, but that is not your patient. And so here I am, I'm a dad of a special needs child, and I'm getting a lot of people going, hey, can you help us out? So these are just two pictures. The kiddo laying on the table on the right, that is actually my son. I just made him put on the stabilizers as part of I needed a picture for my other class. So that's why you can see him if you look closely, he's still trying to look at the camera. It was more just a posing picture. But, these are the little kids sitting next to me. In the other picture, those are 3 siblings, all from Russia that were adopted here in the States. And all of them have some form of cerebral palsy. And so, great. It was a huge challenge, and it kind of, like I said, I saw my career changing, and that was in 15. So, I'm now 12 years into practice when this happened. And so because of that, and just the way that the dynamics changed, I converted my offices to be sensory integrated, which means I made a special needs office. So this picture here, just to show you, this is my waiting room. It kind of looks like my kids' playroom, but I created an environment that people would want to come to the dentist, not, chairs and a TV and a display of what toothbrushes you had for sale. These were my treatment rooms. And I know many of y'all, because y'all have all been to the dentist, you're looking at that and you're going, okay, something's missing. The chair. There is no dental chair in that room. And no, I can't afford it. I'm not that, level anymore where it's like, well, look, we got the room, we just can't afford the chair. The beanbag in that room is my chair. And I'll tell you just a quick secret of why that is because for a special needs patient and a family, they don't have a dental chair in their house. And you have to replicate through desensitization what they do at home or what they do at therapy in your office. So everybody can go to Walmart and buy that same $5 beanbag. And that's how I get kids to acclimate to being in a dental office. And then what you do is you take the beanbag and you have them put that in the dental chair, and the patient sits in the beanbag in the chair. And eventually you take the beanbag out, and now that's how you get a patient with special needs into a chair. So that is the wild, wild world of Dr. Dent's story from college to dental school to current state of affairs. One of the things that Sherry had asked that we go through is, okay, so let's talk about what your day looks like. So I just screenshotted what yesterday was. For all of those that have no idea what this looks like it looks like a hot mess, and in some ways it is. Right column, you know, if you're looking at the screen, so starting on the left column is my hygienist. The second column is pre-ops for my oral surgeon. The third column is treatment for me. Fourth column is emergencies. Fifth column is new patients and consults. And I work 8 to 3 every day. It's an hour and a half one way to my office from my home. So I drive 3 hours a day. So I work 8 to 3. I do not take a lunch. I see somewhere 20 to 30 people in a day. And I go home. I mean, it's still 11 and a half hour, 12-hour day. And it's busy. You know, it's a busy day. And I have some offices, they start at 7 in the morning and they close at 7 at night. But in this practice, I'm the only dentist. And so obviously, my wife would disown me if I stayed at that office. She'd probably say, just live there and don't come home. So a typical day for me, like I said, somewhere around 15 to 30 patients, all the different types. An average production day for me is somewhere between $4,000 or $5,000. And I work 4 days a week. Fridays I have off. Usually I'm either at another practice, I'm teaching, doing lectures. Today I was on the tractor cutting grass out in the pasture. So, you know, I mean, there's really a variety of, it's my day to catch up, but I don't do wet-handed dentistry on Fridays. Staffing, you know, just kind of give you an idea of what my practices look like on average. All of my offices, 1 to 4 doctors, depending on the size and age, 1 to 3 hygienists. Each office has somewhere between 10 to 14 rooms, depending on the space that we were able to get. 2 to 4 front office staff, dental assistants. We try to put 2 dental assistants per doctor. But one of the things that I found was very successful is, and here's another little pearl for the night, your 2 hands can only produce so much. And so if your goal is, I'm going to be a single doctor, private practice, maybe a hygienist, and I want to be a millionaire, good luck. So you make more money with an associate, or what I figured out was if I bring the specialists and hire them to work in my practice, then I make money off of what they make. So I have all the specialists in my office. And so it kind of makes it a one-stop shop, which is very convenient for your patients. And so, like I said, just things to think about at a later date. Okay, now, that was part of my program said we had to talk about cases. So I'm going to talk about, I got 3 cases to tell you. I'm not going to go into detail because honestly, y'all don't know a whole lot about the diagnosis of this, but here's the point. This is a patient that came in this week, and what do we see? Well, there's a few missing teeth, some broken teeth. You got an abscess. You got a bridge there in the front. You got a root canal. These are some of the pictures of that case. I mean, just serious, like if you went out with somebody and you saw that on the back of their teeth, how many people want to take a big wet kiss of that? Nobody. That's nasty. So, you know, there's Dr. Dent's one dating tip for tonight. Check your significant other's teeth, because that's gross. All right. The other thing is when you look at patients and they come in and they have teeth that are broke off, you see that little pink that's in between, that's coming up in the middle of that? That is actually their gum tissue that's growing back through that tooth because the roots are separated. That's how long that thing's been rotted in there. So multiple broken teeth, missing teeth, decay, perio, active abscesses, and this patient was in their late 30s. Now, since we're not doing interactive, here's the standard dental school answer. Always start with infections first, get rid of all the broken teeth and abscesses, then take care of the perio, followed by endo, restorative, and then crown and bridge. Just so you know, that's the answer on the test. They will probably keep that same, question when y'all get in there. Now, here's what the patient comes in and says. Doc, my bridge no longer matches the color of my natural teeth. Can I whiten them? And does my insurance cover whitening? Now, if you look at this patient, just as a realistic person, whitening shouldn't be the first thing that is high on their list, right? I would worry about the abscesses or the broken off teeth or the yuck on the bottom of your back teeth or bottom teeth. So when I said dealing with people is one of the challenges that you face, sometimes you just have to, you kind of give them that dog look and, kind of tilt your head a little bit going, am I being punked, or is this just a weird, Twilight Zone kind of event? So what did we do? I pulled the 2 infected teeth. I got them cleaned, and then we did go ahead and let them whiten their teeth before we went back and did the other stuff. Because obviously we had some restorative to do, and we wanted everything to match. So we got to the whitening, but it wasn't day 1. All right, case 2. This was yesterday. Patient came in, presented with this. Now, those are nice paralleled implants, very nicely placed. All of them currently have a locator attachment. Locator attachments, if you're not familiar with that, those are, think of it like the snaps buttons on your shirt. So people, when they have a denture, it can snap in and they can pull it out and still brush it and snap it back on. It just gives them a little retention. But this patient came in and he had broke the denture. And so, his concern was, well, I look like that villain from James Bond, with just the metal showing in the front of my teeth here. So missing all the upper teeth, 6 implants. But the problem with this patient is you started going at him with the impression tray, and he actually threw up on me. I'm going to tell you all that because there's no glory in dentistry. And I'm trying to take an impression of this man. And like I said, he's in my age range. And the eyes are watering. He's starting to cry, and he's convulsing like this. And I'm like, dude, I can't take this impression out because I got 2.5 minutes before it sets up where it's just goopy. And he's, crying like we're watching a sad show. And finally I take it out and luckily the impression came out okay. But I guess you have to think about it and go, I didn't put that in the book either. This isn't what I signed up for. And in the world of special needs, I tell people I've been bitten, I've been punched in the face, I've been kicked, I've even been peed on. And at this stage of the game, nothing really surprises me. But that's for special needs patients. When I work with neurotypical patients and they do something stupid like that, you go like, come on, really? I thought we were past this. But so what is the treatment plan for that case? We are making him a new denture to fit over that. He also had the option to do screw retained porcelain bridges, which would have gotten him roughly about 10 teeth. So we couldn't have got to molars. And the reason why you see that there is no implants past the most distal there in the premolar area is because his sinuses are right there. And he would have had to go through, he doesn't have enough bone. He would have to go through sinus lifts and bone grafts to get that done, which can be done, but just again, it's about a 6-month healing period. And he gags so bad, it doesn't make sense to put him teeth that far back if he's just going to yak. So we're basically just making him another denture. But a denture was $2,000. If I would have done the screw retained bridges, it was closer to 20. So people that say, well, I'm a restorative dentist, you got those options. Some people that want to do high-end cosmetic cases, they would probably be only suggesting doing this in a implant with fixed where it's screwed in. Okay, last case is this guy. Now, he came in as an oral surgery consult this week, saw the oral surgeon this week, but if you're looking at this case, you go, okay, I see that out of 32 teeth, you've got 2 upper impactions, 1 lower impaction, and everything else is broke off or rotted. So this is a true full mouth extraction. All 32 teeth came out. And when you look down at the bottom right there by his lower left canine between 22 and 23, you see that nice abscess that was forming, that little radiolucency there. And so I had my oral surgeon go ahead and take out all the teeth. He will heal up for probably 2 or 3 months because this is not a good case to do an immediate denture. Because if you think, I don't know if y'all know what immediate dentures are, but basically it's just you make a denture before they pull the teeth, and then the day they pull the teeth, you give them the denture. It never works well if they have this many teeth. So it ends up looking kind of like a bedpan with teeth on it. You know, it's way too big. You put it in, you try to fix it in there for them. It don't work, falls out, and they're pretty peeved about it. But I will tell you, after 18 years, I hate dentures because it is a very much an unrealistic expectation. People say, well, I want to just pull my teeth and get dentures because those are going to be better. They're not. If anybody's gone and gotten those vampire Dracula teeth for Halloween that you put over and you try to actually eat with those, that's what a denture's like. And anybody else that says, well, my mama had dentures and she did fine with them, well, great for your mama, but that ain't going to necessarily be what you have. And, you know, being in the South, you hear that a lot. You hear, well, you know, my mama's got dentures, so I'm going to have dentures. Well, no, that just means your mama didn't brush her damn teeth either, and you should probably have done that a little bit better job yourself. So, you know, don't let them use that excuse with you. Okay, so we talked about that. Okay, so what else do I do on the side? I actually, for the special needs, I am the founder and creator of what's called the Brush and Bite Kit, which is, I made a sensory kit that I can give to parents or therapists for special needs patients so they can practice a basic dental visit at home or at school or during therapy. So we don't have to have a whole lot of wasted time in the dental office. And the toothbrush in there as well, I invented that. It's a 3-sided toothbrush head with a handle that is ergonomic for patients with low dexterity. And at the end of it, you see that little diamond. That's actually a dental bite block that I incorporated into the back because a lot of times parents have struggles with getting their kids to open their teeth. And so obviously that's a way to prop their mouth open. I am one of the clinical directors for Special Olympics, Special Smiles. And like I said, you know, talking about mentors. My mentor was actually Dr. Stephen Perlman, who is the founder of the Special Olympics Healthy Athletes Program. He was actually, doesn't practice now, but he was a pediatric dentist in Boston. He actually treated President Kennedy's special needs sister, Rosemary. And that's how the Healthy Athletes Program through the Special Olympics came about. So if you're interested in doing any kind of special needs or just want to volunteer in the world of dentistry and at this level, go to your local Special Olympics, go to Healthy Athletes, and you can do screenings with them. I'm always happy to take volunteers. Like I said, I do speak. Sometimes they let me speak where they make me dress up, like at the AGD. So I'm official. Most of the time, when I go speak, as you see in the other picture, I wear always funny suits because it's memorable. Because as I tell my class, if you're not the smartest guy in the room, you better be the best dressed. So I always go with a very unique looking suit. Since y'all are in Florida and I'm an LSU guy, you can tell this is a full LSU suit that I had on. I actually wore that when I went and taught in Alabama because we all don't like Alabama in the SEC. So that's a fair statement. But you got to, like I said, you got to, as a speaker and instructor, even tonight, you will find in the world of dentistry, you will take enough CE classes that will absolutely bore you to death. You will take enough dental school classes that will absolutely bore you to death. My rules for that is find someone that is passionate about what they're doing and not just reads a PowerPoint to you because that's stupid and boring. You're intelligent enough, you can read their own PowerPoint. The other thing is learn to sleep sitting up, because in dental school, if you put your head down, they know you're sleeping. But if you sit up and you find something closer to the back where your head crossed back, they'll never see it. They turn the lights down. I mastered that. It was wonderful. So here are some helpful hints to get you into dental school. Everybody has to have a good GPA. If you're dumb, you ain't going to get in. So you might as well just end the call now. Your DAT score. I will tell you, I got a 17 on my DAT. That is like the bare minimum to get into school. I was a 4.0 student, but I took my DAT in my third year. I hadn't even taken organic chemistry yet. So that kind of brought me down, but hey, I still got in. Some of the things that you need that they're looking for. Be well-rounded. That doesn't mean I'm the president of the Glee Club. Well-rounded means, show that you can survive the stresses that are going to come with dental school. What are they looking for? Dental schools only accept an X number amount of people. If you drop out, you can't cut it. They can't replace you. And dental schools, like any other practice, they're there to make money. You are their workhorse in year 3 and 4. And so you've got to be able to survive, and that's what they're looking for. They want to look for somebody that's been through, challenges in that state. Get experience in the dental field. If you can, start with, going to a local dentist, maybe your dentist. Ask them if you can just go shadow for a couple of days. Depending on the dentist, they may let you get in there and do something. I've got some dental students that are coming and doing some shadow days, and so find that, because that's good as well. Or hell, if you're early up in college and you're not graduating just yet, go see if you can become a dental assistant as your part-time job. I would be happy to hire a college student that's a dental assistant that is also looking to go to dental school. And then look at the school entry requirements. The reason why I got into dental school after 3 years is because I just read the damn manual. I just looked at it and said, okay, I have to have this class, which was a senior level class. And so I just took it during my junior year, and I forewent basket weaving or, fine art music appreciation or whatever. That really had nothing to do with dental school. So if you can take all your prereqs, you can apply earlier. And like I said, LSU was one of the schools that would let you in after 90 core hours. And I had 91. So I was officially, past that point. This is just my contact information. If anybody would like to reach out, like I said, I'm on Facebook, as everybody in the world is, Instagram. If you want to email me, specialneedswarriordoc. The little guy down there, that is my trademark logo. My tattoo artist actually drew that, so I always try to give him props during my my lectures. So if you saw like my whole arm, I didn't get my first tattoo till I was 35 years old. true story. This wasn't like some drunk 19-year-old thing. I didn't get my first tattoo till I was 35, but it's a full armor because that's why it's a special needs warrior. So if you wonder why the tooth is like that. So good luck. This is a picture of me. I had a guy that came he was in Houston. He was from Alabama, was at University of Alabama, and he came in and needed a wisdom tooth pulled. And he was like, my fraternity brothers ain't going to believe that I had some LSU doc pull my tooth. And so we did it up. We got his face painted, and we took a picture. But here's a fun fact. Arkansas is the only state in the SEC without a dental school. And LSU has to take 5 students from Arkansas every year. Just a fun fact there. So we are now, folks, 7:52. We got a few minutes, so I will hang around and answer questions. And if anybody's got anything, I'd be happy to answer for it. I'll give you my honest opinion for tonight.
Thank you, Dr. Dent, for taking the time to be here with us today and preparing this presentation. It was really interesting to learn about your personal experience and your cases. With that said, we do have a few questions in the chat, if that's all right with you.
Fire away.
Okay, so the first question is, how did COVID impact your practices?
COVID sucked. It shut my office down. In Louisiana, basically we were shut down for 4 months out of the year last year, just with the restrictions. I mean, you could do emergencies, but basically you had to be swollen, bleeding, or dying, and they really preferred you be doing all 3 at the same time to get an appointment. So it really hurt. I had to furlough 90% of my staff till I could get back up. So yeah, it sucked quite a bit.
Thank you so much, Dr. Dent, for your response. The next question is, how do you deal with difficult patients?
You are always going to find difficult patients. And someone once told me a difficult patient in a bad situation is just an opportunity to make that patient into a lifelong patient. And so you're going to have patients that you just don't jive with. It's kind of like, hey, I don't like you, you don't like me, our personalities don't go. And, at this stage of my career, I've had enough people that come in and I'll tell them, look, if you don't like me, there's a dentist right around. I could throw a rock and hit 3 dentists. So I'm not the only guy in town, so feel free to go anywhere you want. But when it comes to things that are, what is the most common reason why people get pissed off in an office? It's because expectations weren't set, and then the expectations weren't met. And those usually only revolve around time and money. And so my advice is, if you don't mess with people's time and you don't mess with people's money, if your crown's a half shade darker or lighter, they really ain't gonna care. But like I said, just avoid those 2 big boogaboos and you'll be fine.
Thank you, Dr. Dent. So as you stated, you've been in the dental game for quite a while. So what is something that you wish someone had told you in the past that you could change?
Man, that's a bottle of wine and a lot of hours later to probably go through all of that answer. What would I change? I would probably say that I wish someone would have told me in the beginning how little I knew about being a dentist in the business sense would affect my career path. Like I said, I mean, there's a large discrepancy between being a good dentist and being a good business owner. And look in the curriculum, there is 0 business classes that you will be given in dental school. And so if you have the opportunity as an undergrad, take business classes. Learn. I didn't even know what a damn tax ID number was. You kind of have to have one of those to open a business. like I said, I don't know how to hire and fire. Y'all are at an advantage right now. Hell, y'all can go on podcast and learn stuff while you drive now. So take leadership classes, take things that are going to improve your skill set as a leader. Not, the dentistry will take care of itself. But yeah, I think so. If someone would have told me, hey, it ain't just about drilling and filling, I would have probably changed some of the classes I took at y'all's level. But here's the other question, and maybe someone will ask this, maybe don't, but I get this question a lot. If you had to do it again, would you? I don't know. And I would tell you this, I love what I do in the special needs world, because I'm one of maybe a handful of people in this country that do it at the level that I do it at. And I'm proud of that. But if you came to me tomorrow and said, Doc, you can never do another filling for the rest of your life, I would not shed a tear. I would be perfectly content with that. So I don't know if that answers the question, but at this stage, you get to a point where do what you want to do, and don't do what you don't want to do.
Thank you for your response, Dr. Dent. Our next question is, what is your advice for someone wanting to pursue dental school or residency at an older age, around the early 30s?
Hell, do it. Why not? I hired, in fact, one of my associates in my Houston practice, I hired her and she was 55 and she just got out. Second career. I had a guy that was in dental school with me. He was also a NASA engineer. So there's a lot of people that have made it to a certain point in their life, late 20s, 30s. I was one of the youngest in my class. Like I said, I graduated at 24, but there was a guy in my class. He just happened to be one of my partners for labs, and he was the oldest guy in my class, and he started dental school at 42. So age isn't the restricting factor here, but you realize to make money in this, to actually get out something, you're probably going to have to put in probably a solid 20 years. And going back to the student loan debt, I got out of dental school with $100,000 in student loan debt. I'm 18 years into it, and I still owe 50, and that's been paying $500 every month for 18 years. And the average right now is 3 times that. So the average dental student comes out with somewhere around $1,500 to $2,000 a month just in your student loan. So yeah, put that on your plate and think about it. All right, next question. What you got?
Okay, thank you, Dr. Dan. So the next question we have is, what other techniques or methods have you implemented to your practice to deal with patients to help them feel more comfortable?
Well, I mean, like I said, I'm in the special needs world, so we really just did it with surroundings. Like I said, we made everything sensory integrated. People want to come into offices that feel kind of like their home. So, you go to a hospital, example, and it's a very sterile area. Everything is white walled and, smells like Clorox. And that's great for a hospital, but it has to be more inviting. Now, I'm not telling you go into a spa dentistry where you hire somebody to rub somebody's feet and paint their nails while they're getting their cleaning done. You don't have to buy $20,000 worth of finer drapes for your windows or anything stupid like that, but make it homey, and how you do that. Like I said, I did it with sensory items, but like your staff, have your staff put up pictures of their family, and think of it like when y'all go to each other's houses or your apartments. Like, it needs to be an outward expression of who you are, because it doesn't matter what career you choose, dentistry or whatnot, but people buy people. They're not buying your dentistry. Nobody's going to give two craps what kind of anatomy you put into your carvings of their tooth if they don't like you. So be likable. Be a good person. You know, it takes a lot more effort to have a good attitude and be a good person than it does to be a good dentist.
Thank you so much for your response. Another question is, how did you start up a new practice and then expanding from there after your first one, not going
Sweat and
as you
tears.
planned?
Sweat and tears. So new practices. When I start a new practice, I expect it to actually not make a dime for 3 years. Most of my offices, honestly, somewhere between 10 to 30,000 a month, we're in the red. And so we have a business plan accordingly. And so we try to stay on that business plan. But I'll give you an example. When I bought my first practice in Houston with Pacific, my out-of-pocket was about $150,000 for my portion of the practice. And 10 years later, I sold that practice for $1.1 million. I didn't get a dime out of that practice for 3 years. So I'm paying a note to the bank for the portion of money that I paid them just based off of my percentage of what I made with my own two hands. So I didn't earn any money through the practice, and that's one of the things that people don't realize is just because you buy a practice don't mean it's going to pay you money, you know. So be prepared that you're gonna be slow in the beginning. So normally what I do is I'll open a practice. I will myself personally, that's what I'm doing right now in Lake Charles. I build the practice up. I hire an associate dentist. I mentor that dentist to make sure that they can do it at the level that I do it. And then I start backing out of the practice, giving them more of the lead role. And then I move on to the next practice.
And to follow up on that question, do you have any kind of advertising for your practices?
Yes, and I will tell you that one of the benefits is I don't have to do it. So we have a whole marketing team that does that. Most of it is online advertising, Google searches. You know, you can do pay-per-clicks and all this fun stuff. You know, the days of mailers and all that stuff are really outdated because think about it. You go check your mailbox. If it ain't a bill or a check, you really don't look at it. So they're pretty much a waste of money. And said, you know, if you create something, here's the thing: if you create something and it brings a value to your area, and you do it so well that people will tell other people about it, you don't have to market. I don't market that I do special needs, but like I said, I get people from every state driving hours to come see me because of just hell, Facebook does it. You know, I get a lot of referrals just out of Facebook. But, you know, people try. Look at all the dentists around you. Look at all the gimmicks that they have. You know, free exam and x-rays, free whitening, come get a free toothbrush. I mean, great, you know. If you did it right, you could go to 3 different dentists and have white teeth, a new toothbrush, and get your exam and cleaning for free. You didn't have to pay a damn thing.
Thank you, Dr. Dent. The next question that we have is, how did you go about finding a mentor, and how did you learn about like all the business aspect that dental school didn't teach you?
How did I find a mentor? I walked up to Dr. Perlman at a conference in Vegas and I said, hi, my name is Jacob Dent. I've got a special needs child. I'd like to learn more about special needs dentistry. Will you teach me? Ask. You know, the worst thing they're going to tell you is no. And so find somebody that you admire, and like I said, that could be your local dentist that you went to as a kid. It could be somebody that you heard at a conference. Or it could be, some old guy from Louisiana that's talking to you late at night on a Friday, hell, I don't know. But find somebody that you actually, want to learn from. That's a good part. And you want to emulate. What was the second part of that question? Tell me again.
Oh, how did you learn all the business aspects of dentistry, or was it all just trial and error?
For the first couple of years, it was trial and error, and that's bologna sandwiches. Don't do that. The second answer is, again, find a mentor, and basically someone that's been doing it for a while, and someone that is eating a little bit higher on the hog, and you go, okay, so obviously you got a plan that's worked. I want to see if I can not necessarily duplicate it, but can I take a portion of that may fit into my plan? So I've got some colleagues around me that are specialists that do very well for themselves, and so I want to know how that worked. I want to know from non-dentists how to run a business. So I found a friend through business networking who was a financial advisor. Start now, learning how to invest and save your money. But like I said, your two hands are going to eventually top out. You can only do so much. But if you learn how to make your money work for you, that is the key to success.
Okay, thank you, Dr. Dent. And unfortunately, we are on our final question of the night. So the last question is, how do you deal with all the stress of being a dentist as well as owning several practices?
Well, I make wine in my house in a filing bucket. Is that an answer? No. Drink heavily is not a good answer, so I'll take that back. That is not my final answer. You have to find something that is not dentistry. Like I said, I will say this out loud. I hate dentistry. I love what I do, but if you just said, I need you to go work 8 hours a day and drill and fill on ungrateful people who don't like you, and then drive 3 hours on top of that, why the hell would you do that? So I found a part of dentistry that I loved. I have a passion for, and that's the special needs world. Other than that, I spend my time with my family. Like I said, I have a place out in the country, and so it's a getaway. I enjoy taking the time. Like I said, today I spent 3 hours on the tractor cutting grass, and it's quiet and nobody bothers you. So find a hobby. That's also a good thing.
Thank you, Dr. Dent, and thank you so much for taking the time to be here with us on your day off and for taking the time to answer all of our questions.
You're more than welcome. Thank y'all for having me. And like I said, you have my information. If anybody wants to reach out, message me on social media. I'll be happy to respond, and hope everybody has a great weekend.
Thank you. And just before we end today's session, the link for the quiz will be posted in our group meet. And thank you again, Dr. Dent, for being here with us. We hope you have a great night.